Going Smoke-Free is Perfect for You and Me by Kaylee Herring. First, we're going to talk about the health risk associated with smoking. Cancer, the second leading cause of death in the United States. Some of the different types of cancer you can get from smoking are esophagus, cervix, kidney, stomach, mouth, lung. Next is cardiovascular disease. Increased risk of coronary heart disease, the leading cause of death in the U.S. Increased risk for stroke, the third leading cause of death in the U.S. It also can damage your arteries and the cells lining the blood vessels and the heart, and increased risk for blood clots. Next is respiratory disease. Smoking leads to lungs that can't fight infection, injuries for your lungs tissue. Lung tissue damage leads to chronic obstructive pulmonary disease, COPD, the fourth leading cause of death in the U.S. Next, it harms reproduction. It's harder to conceive when you've been smoking. It also puts your pregnancy at a greater risk for chance of complications. It can also result in a low birth weight, which is the leading cause of infant death. Finally, overall health. Smokers are less healthy than non-smokers. Smoking will prevent your cells from getting the correct amount of oxygen needed to work properly. It increases your risk of hospitalization, sexual reproductive problems, cataracts, gum disease, and tooth loss. Next, the benefits of quitting. When people stop smoking, their risk of developing heart disease and some kinds of cancer, if not already present in the body, eventually decrease to that of non-smokers. In other words, some of the effects of smoking are reversible. There are some immediate results and more significant results the longer you're smoke-free. If you look at this chart, it shows you some of the results that you could potentially get if from immediately quitting all the way up into a year. If you look at immediate, the air around you is no longer dangerous to children and adults. And if you look like halfway through, let's say maybe 48 hours, nerve endings start to regrow, exercise gets easier, your sense of smell and taste start to improve. And then if you look all the way at a year, it says your risk of early heart disease falls by 50%. Next, the impact of going smoke-free. Secondhand smoke is the third leading cause of preventable death in the United States. So, if you're not smoking, the people around you are breathing cleaner air, which equals healthier individuals breathing that air. It can reduce the risk of cancer and frequency or severity of asthma attacks, and it can also reduce the risk of a variety of upper and lower respiratory illnesses for others if you eliminate that secondhand smoke factor. Also, cigarettes pollute the air with carbon dioxide and methane, leaving a visible footprint for climate change. So the picture is bigger than just us, but also the environment. Cigarette butts that end up everywhere are not biodegradable. It can also be a big fire hazard, throwing our cigarette butts everywhere. Are you ready to quit? Behavior change theories can help evaluate a person's readiness to quit smoking. A series of questions can help determine a person's readiness: their self-confidence and commitment, whether they have a plan in place, a good support group, and their ability to manage the environment. It's important to be a role model. Being a good role model is talking the talk and walking the walk. Lead by example, and you could help save the life of you as well as many others. It can also help save the environment. Motivation for each stage of change. Pre-contemplation. Educate member about health risk related to lifestyle choices. Contemplation. Help the member appreciate the disconnect between stated goals or concerns and lifestyle choices. Preparation. Offer several choices on how to change and reach the desired outcome. Action. Track progress. Maintenance. Identify things that could trigger the relapse and continue to help the member avoid those triggers. There are some aids you can use to help with ceasing smoking. One of them is nicotine gum. Like a cigarette, it contains nicotine but without all the harmful chemicals and tar. Starting cost is about $50 and refills would be about $30. Another is the Nicotrol inhaler, which, similar to the gum, also contains nicotine without all the bad chemicals and tar, and it's better to help someone who misses the feeling of maybe holding a cigarette. Thank you for watching my slideshow, and I hope you've decided to quit.